If you clicked on this video, you likely are starting to notice some under eye dark circles. And you know what, friend? Me too. It is a complicated issue to solve, but we're going to kind of break it down today. We're going to talk about why it happens, when it happens, and I'll give you some practical tips both in your habit formation and in your skincare makeup that can help you either avoid dark circles or camouflage them once they're there. Welcome to Eye School with Dr. D, where my goal is to arm you with the knowledge you need to take control of your eye health and have the best vision possible. Like and subscribe for videos every week. Hi, I'm Dr. D. I'm a doctor of optometry with my own private practice. I'm residency trained in ocular disease and I specialize in dry eye. Here on this channel, I post educational videos about eye health and vision products. If you're new here, make sure to like and subscribe and hit the bell so you never miss a video. While you're at it, take a look at our show notes down below. I've got helpful tips, tricks, links, and in this video, lots of products linked out so you can look at the stuff I'm talking about. All right, my pupils, it's time for Eye School. Let's get into it, shall we? So first, we're going to talk a little bit about the causes of dark under eye circles. And friends, it's complicated. So under eye circles can happen for many, many different reasons. I'll need my notes. Hold on. Okay, all right, here we are. Number one, you might be having shadowing. That could be a lighting issue. For instance, I'm sitting here with wonderful lighting on my face to hopefully prevent dark circles. But it's possible that some of the dark circles that you're seeing are simply due to shadowing. Secondly, you could have thin skin. The eyelid skin and under eyelid skin is generally recognized as the thinnest skin on the body. And if you have very prominent vessels kind of beneath that skin, they're going to show through. It's possible for you to have bigger, more prominent vessels than others. It's also possible for you to have just more capillaries and more blood vessels under the surface that are showing through. In addition, it's possible for your muscle to be showing through. That orbicularis oculi is just sort of deep reddish in appearance, and so it's going to cast a dark hue if your skin is particularly thin and it shows through. Over time, with age, that skin even thins out more, and that's why sometimes over time you'll see the appearance of dark circles coming out more. And finally is actual true hyperpigmentation. I think a lot of us have the sense that, oh, I just have hyperpigmentation. But in fact, sometimes it's those other first two causes. Either you're having some shadowing effect or you have very thin skin there. But the third one is hyperpigmentation, and that can occur as a result of chronic inflammation in the area, whether that be from allergies or a dermatitis type sensitivity to eye makeup or eye creams that you use. You may also have eczema that's caused kind of a post-inflammatory hyperpigmentation to that area of your face. So we're going to talk about all of those causes and some specific things you can do to help with each of the causes. But first, we're going to talk a little bit about habit formation because there are many things you can do to reduce the appearance of your dark circles, no matter sort of what they're from. All right, so let's talk about some of the causes of darkness and under eye circles that are habit related or things that you can change. Now, first of all, I want to give a shout out to my friend and colleague, Dr. Joey Allen of Dr. Eye Health, because he made a great video about under eye circles, and we'll make sure to link it above. But he goes through a really comprehensive, good explanation of a lot of these habit changes. So if you want more info, definitely check out his video for the rest of the scoop. There are plenty of things that affect how much your dark circles are kind of coming out. Your habits, like your sleep, alcohol intake, smoking, poor nutrition, excessive salt. Internal things like stress, anger, anxiety, things like that happen. Heredity, it just might run in your family. Being dehydrated. Other external things like having a lot of ocular allergies and doing just a lot of eye rubbing. Air pollution, UV exposure. Too much UV exposure can further exacerbate this hyperpigmentation effect. Screen time, having way too much screen time, makeup use, and contact lens overwear can all impact how much darkness we see under your eyes. So the first thing is to work on habit modification. Ideally, you want to aim for 8 hours of sleep a night. Limit your screen time as much as you can before bed, and consider putting on the blue light filter on your phone so that you reduce your blue light exposure, which allows your melatonin and your sleep-wake cycles to work as they should. The second is to practice sun care. So wearing sunglasses, UV protective, polarized. I made a whole video about what you need in your sunglasses. Check it out above, but make sure you always wear sunglasses. You can also get a wide brim hat, and using sunscreen is a good idea. So one of my favorites is this Ulta MD, the UV Clear Broad Spectrum SPF 46. My face tolerates this really well, and I'm notoriously very, very sensitive to sunscreen on my face. But this one comes highly recommended. It is a dermatologist recommended brand, and it's my personal favorite for using on this delicate under eye area. Another habit to work on is makeup removal. One of the most important aspects of wearing makeup, yes, it's important to choose hypoallergenic and flip that bottle over and choose the best products you can. But the single most important thing is to take that makeup off at night, every single night. I would recommend doing so with a makeup eraser and potentially micellar water. Those are great things to start with. Another habit to work on is consumables. So what are you eating? What are you drinking? Reducing smoking, reducing alcohol intake, increasing water, stay hydrated, reduce your salt intake, and consider doing an anti-inflammatory diet. Lots of vegetables and fruits and antioxidants. Next, self-care. So anger and anxiety and all of these negative emotions, although we all feel them, don't help with things like dark circles. And so looking at self-care, meditation, yoga, exercise is one of the best forms of medicine out there. Next, we have allergy control. Using cold compresses on itchy eyes instead of just immediately trying to rub them. Potentially using an over-the-counter drop. So Aloe, Zaditor, Pataday. Pataday went over the counter last spring, and it's a drop that I prescribed for many years for allergies. So we now have these stronger options over the counter. I just found out this week that Aloe preservative free is becoming available for this spring season. And that's an incredible thing to have a preservative free allergy drop available. And then just avoid rubbing your eyes. That's so important. So that concludes the habit formation, like little things you can work on day-to-day section of the video. And next we're gonna get into the more specific eye creams and makeups that you should look for when trying to treat and/or camouflage dark circles. So let's talk about that very first topic from the video, which is shadowing. Shadowing and that causing dark circles is caused by poor lighting, eye bags, and potentially having deep tear troughs. Now, as we get older, I talked about how our skin thins out a little bit, but you can also have a bulging of the periorbital fat pads, or you can have the fat pads that sort of like just they become more defined. You sort of lose that filler, that natural filler in your face. So if you're noticing that that's the case, where you used to have just sort of more supple looking skin here, and over time you've got more of a tear trough, more of a deep depression under your eyelid, you may think about things like better lighting if you're in a video situation, reducing your sodium intake, hydrating or plumping eye cream. So this is where having a cream with caffeine in it is very helpful. You can also get injectable filler done in this area, but that would be by a dermatologist. So make sure to talk to your dermatologist about that option. So my pick for a cream for this particular issue is the Cetaphil? Is the Cetaphil Hydrating Eye Cream. This cream contains hyaluronic acid. It's going to help draw water to the area, plumping that skin and reducing that effect of the sort of hollowed out deep tear trough. In addition, I'll often do things like these hyaluronic eye patches, either first thing when I wake up and I'm sort of curling my hair before I put makeup on, I'll have these under my eyes. Or at night, I'll use a hyaluronic collagen overall face mask. And anything with hyaluronic acid in it is going to help draw water to the area because hyaluronic acid is so good. It can hold up to like 1,000 times its weight in water or something like that. It's definitely a lot more than its weight in water. And so it really helps to plump tissues, and that's why you're seeing it in so much skincare nowadays. So anything with hyaluronic acid in it is pretty good. And we'll link our pick for the hydrating gel cream down below. Now the second issue is thin skin, and I've made a big point of that this skin is very thin. But something else about it is that there are no like sweat glands in that area, and so this part of the face tends to get a lot drier than the rest. So it becomes very important to moisturize your under eye. So for thin under eye skin, what we're trying to do is either thicken up that skin or shrink the vessels. So I earlier stated with shadowing that you would want to use a caffeine cream. That's not wrong, but the caffeine is a little more specific to this issue, which is the thin skin and the dilated blood vessels underneath, or that. Okay, so anyway, for thin skin with prominent vessels underneath, consider the Vichy eye cream with caffeine. That's going to help shrink down those vessels and reduce their appearance. All right, the second product is the Ordinary Skin Cream with caffeine solution and EGCG. Not as much my area. This was brought to me by my wonderful office manager who watches a lot of Cassandra Bankson. So we'll link that video down below so you can check out her take on that cream, but that is a good one for this particular issue. The next thing to consider, so when we talk about trying to actually thicken up that skin, one of the first things that comes to mind if you know skincare at all is retinol. But if you watch my channel at all, you know I recently made a video about the dangers of retinol and how it can actually impact our meibomian glands and cause them to fall out, drop out, not work as well, and how that's a really big issue for dry eye. So as it pertains to retinol in this area, I would truly try to avoid it if possible. Anywhere inside of your orbital bone, I would not put retinol directly there. If you're going to do that, and that's the only thing that helps with your dark circles, then make sure to see an optometrist, an eye care provider who is able to image your meibomian glands and make sure that you're not having loss of them. Losing meibomian glands can truly lead to some pretty bad dry eye, and so if I were, in the practice of putting retinol in that area, I would just really want to watch those glands and make sure I wasn't causing a dry eye issue for the long term. Bakuchiol, I think that's how you say it, is an alternative to retinol. I know that it has many of the same effects. Again, plenty of estheticians and dermatologists out there have talked about this. One of my favorites, Dr. Sam in the City, and I know that her products contain this bakuchiol. However, I was unable to find whether or not that's shown in the literature to cause the problems with the meibomian glands. I just don't know that information for sure. Epidermal growth factor has also been cited as something that can help thicken the skin and plump that area. I don't have a ton of personal experience with it, but it's something to look into. And finally, LED light therapy. So LED light therapy stimulates collagen production. I've talked about this in a video before, and it also reduces the signs of fine lines and wrinkles. Something like this, the Dr. Gross Spectralight Eye Mask, is something that I use every day or almost every day. And this is low-level light therapy. It depends on if the mask, it gets that under eye area. So that's definitely something to try as well. I personally use a mask like this, and I do find that it helps. As it pertains to that low-level light therapy, as long as the treatment is actually over this area and actually hitting that area, I think that it's safe to use and certainly something that you can try. As a whole, whether you have shadowing or whether you have thin skin, these two things, the goal is the same. The goal is shrink blood vessels underneath the skin and thicken the skin if possible. So if you're finding products that are going to do those things, that is the goal, and that's ultimately going to help with your dark circles. Finally, we have hyperpigmentation. So hyperpigmentation is caused by genetics, allergic reactions, eczema causing post-inflammatory hyperpigmentation, and even excessive sun exposure. You can treat that by wearing a sunscreen or even wearing a tinted sunscreen to sort of change the appearance of that under eye area. The benefit of a tinted sunscreen, and my favorite is the Origins tinted sunscreen, but it does kind of improve the appearance without being a foundation or without being a cover up, while also protecting the area. You can also treat with products that have active ingredients that are going to reduce the appearance of pigmentation. So things like kojic acid, niacinamide, vitamin B3, vitamin C is great for that, tranexamic acid, azelaic acid, and alpha-arbutin. Alpha-arbutin. So I'm going to link a bunch of products with those different ingredients down below, and you can take a look at those as well. When it comes to makeup for under eye circles and dark circles under the eye, this is going to give you a more immediate cover up, obviously. And so any skincare that you do, any of the things we talked about before, are going to take days, weeks to have any real effect. And so you might want a quicker cover up than that, and that's where makeup really is nice. So with concealer, the NYX palette is going to have multiple different colors so that you can choose the right specific color to counteract your particular skin discoloration. If you're a makeup noob like me, it's basically color theory. Green counteracts red, red counteracts green. You wouldn't be using red though, that would look crazy. See? So yeah, we're going to link our favorites down below for concealers, and those are wonderful. All right, guys, thank you so much for tuning in. I hope that was a really nice overview of dark circles and all of the things that sort of affect them. They truly can be a pretty complicated thing to try to get rid of because, like I said, there's so many habit and lifestyle factors involved, so many genetic factors, just sort of your own skin tone and your own face, your own facial composition and shadowing, and all of that plays a role. And so it's likely going to be different for you than your best friend and your work colleagues and anybody else. So take a look at all of these options, figure out which ones you've already modified and things you can try. And let me know down in the comments which kind of combination. I like to think of it as the compliment section. Leave your compliments down below. So make sure to tell me your specific combination of things down in the comments below, because that is sort of different for everybody, and we can all learn from each other. Make sure to like and subscribe if you haven't already. We make videos every single week, and I hope to see you next time.